because like, I don't know, the medical system is just ingraining more and more, like, this is how we make it better. We've got to control it more. Like there's something in the medical school training that's not even getting them to flag, like, this isn't humane. Like, it's interesting how the teaching is pathwayed. Mhm.
Yes, yes. And it's
Mhm.
interesting. Yes, it's interesting. And in Cincinnati, at least, that home birth practice, we had excellent statistics. I mean, just
Yeah.
excellent statistics in terms of our C-section rate. It was less than
Mhm.
10%. Our outcomes were wonderful.
Yeah.
It was very, very good. And so he did several things that I thought were important. One was one of the first things he said is he said the best thing an obstetrician can do is sit on their hands,
I
because he
need a
said
quote from him and he sign it and we put it everywhere and we'll pass it on to ACOG. Yeah.
Uh, because that's what he said. He said, we always want to intervene, and why? Labors are very variable and women deal with it totally differently, and you just give it time, and most of the time it'll happen. And we want to intervene and we want to get in there, and we usually complicate things and the outcomes are worse. The other very memorable thing I remember was that the first time I ever had a retained placenta. And
Mhm.
so was at a home birth, and he happened to be there. Sometimes insurance would cover it. That was a point where insurance would cover home births. They don't anymore, but they did at that time. And but he had to be there in order for it to be covered by insurance. So he was just there, and I think he was reading a newspaper and kind of in the background. He never interfered. He let us do what we needed to do. But I told him, I said, it's been more than a half hour. I feel like her bleeding is increasing right now, and it feels like we need to do something. And so I was stepping out of the way for him to come in, and he said, no, no, no. He said, look at the size of your hands and look at the size of my hands. You're the one that needs to do this. So,
Mhm.
because of course she's natural, and of course it's a really tricky
Yeah,
thing.
hurts and small and gentle
Yeah,
as best you
exactly.
can of
Yeah,
a
yeah.
manual extraction. Ugh. Yeah.
Exactly, exactly. So
Mhm.
he talked me through it, and just gently and very patiently, and just said,
Yeah.
this is what you're going to do. And he just talked
Well,
me through
even just the simple little art of teaching the next generation of midwives how powerful it is just to talk to them for 5, 10 seconds before you do something. It makes a huge difference. That fear, that anxiety of like people just do. I'm like, I understand this is quote unquote a medical emergency, but 5 seconds of just talking to her and say, I'm so sorry you're bleeding more than ever. Like, this is the art of home birth that we just don't see in the hospital much. Like, I am so sorry you're bleeding, but I have to. This is going to hurt for about 30 seconds. And it's really important. And I will talk through it and breathe. And then you do it versus you just are doing all this stuff to her. And she's like, "Ah."
exactly, exactly. It's
Yeah.
scary, it hurts. I mean, it feels like you just can take even the pain better if you understand why and what you're doing, what